first thing on the sheet are the meninges, and those are the 3 layers that cover the brain. The outermost layer is the dura mater, which means a strong mother. In between the dura mater is the arachnoid mater. It's called that because it looks like a sort of spider webbing, and that's where the cerebrospinal fluid will swish around. And then the pia mater is the one that is going to innervate all of these little surfaces in the brain, which are the little grooves and divots all over it. So the first part, this is the cerebrum of the brain. This is the major part, the cerebrum. Right here, these are the cerebellum. Okay. This lump right here is the pons, and if you look at here, it's just the first big hill of this little mountain range. And then directly under the pons, you have the medulla oblongata, which is right here, and then that leads to the spinal cord. So if you looked at it like this, you have the pons, the medulla oblongata, and then the spinal cord. Right here, you have the olfactory bulb and nerve, and optic nerve. Let me check that. Okay, the optic nerve comes down here, and this is the optic chiasma. Then there is the mammillary bodies are, I'll try to pen, these 2 little dots down here, right there and there. If you open the brain, it's this bit. Can you see that? Mm-hmm. That is the mammillary body. This area right here is the hypothalamus. Then the pituitary gland is the one that's going to sit inside of the, what is it called? The sella turcica, yeah. The sphenoid bone. So that's where the pituitary gland would be, but it's not here, but it would be dangling right there. The pineal gland is further back, is right there.
Is it the space or is it the actual?
No, it's that little, yeah, that little dot. Major stripe, yeah. That little dot is the pineal gland. Then you next have the corpus callosum, which is this space that's yellow right here. That is the corpus callosum. Within the corpus callosum, at the front, you have the splenius. The back is the genu, and this space in between is the septum pellucidum. Okay, and then we're going to do the superior cortex. Sorry, wrong part of the brain. Just want to make sure this is right. Okay, so along the brain is the this is your central sulcus going across this way. And you have your temporal lobe, occipital lobe, frontal lobe, parietal lobe, and all of those are going to be separated by different sulcuses that go across. I'm trying to think the page has the right name. Do you see them?
What is it for?
The specific name of the sulcuses.
Central sulcus and lateral sulcus?
Yeah, but I just want to make sure that I'm pointing out the right ones. Here it is. No, that's not it. Okay, yeah. So this fissure going down right here is the longitudinal fissure. The central sulcus, as I said earlier, goes across the brain, and that's what's going to separate the frontal lobe from the temporal lobes on the sides. Then you have, I think that's it for the lobes.
What's the 4th ventricle?
Oh, okay. The ventricles are spaces within the brain, and if you might want to show this picture in your video, because it's really helpful. It's these spaces, and within these ventricles, this is where cerebral spinal fluid is going to be held, and so this is where, when your brain sends out hormonal signals, it puts everything in here, swishes around, and goes out to the body, and comes back. And so those different spaces, you have the, I think all we need to know, which ones do you need to know? Oh, the lateral and 4th ventricles. Okay, the 4th ventricles are the ones that are inside. This is called the midbrain, which is the pons, the medulla oblongata, and the spinal cord, and that's where the 4th ventricles are, right? And then the lateral ventricles are going to be the ones that are going to be inside of the brain on the lateral sides, which is why they're called that. Okay, and I think that's all you need to know.
Can you go over the cranial nerve?
Yes. There's, I mean, this project is super helpful because here are all of them, and then this is each of them that has its own spot where the book will talk about like what you do and stuff like that. Mm-hmm. But I mean, because I can point them out, they're just right here. The first cranial nerve is this is where the olfactory nerve ends. And remember, it goes O, O, O. So this is the first O. And
forget
that
that.
leads to, huh?
Can't forget that.
Yeah, right? This leads to the olfactory tract. This area right here, again, is the optic chiasma. And then we have the second nerve, which is the optic nerve, which goes off here. So this is the first one, is the olfactory bulb, so olfactory nerve, and then optic nerve. The next one is the oculomotor nerve, which comes off right below it. See how this one branches this way, and those go down that way. So that's the oculomotor nerve. Right here you have 3 nerves. You see this? So that's 1, 2, 3. Sorry, 1, 2, 3. That's gonna be 4, 5, and 6. So the fourth one is the trochlear nerve right here. And it's this one of those areas. It's superior to the pons, most central in the brain of those 3. So it goes trochlear, then trigeminal nerve, which is the 4th one right here. I'm sorry, the 5th one here, and then it goes. Oh, I'm sorry. It's these 3 are the next 3. It goes. Give me a second.
I'll put this video on YouTube now.
Yeah, no, but this is confusing me. I'm sorry, I had it up. I can't do it backwards. That's what's throwing me off. Because it's optic, oculomotor. Oh, then it's this one. I'm sorry. Optic, oculomotor. Yeah, I should do the wrong ones. This one right here is the oculomotor nerve.
So it goes
Stick.
1, 2,
Yeah, and I'll use this. Yeah, this is 1. I'm just going to use 1, 2. This is the oculomotor, so optic. I'm sorry, olfactory, optic, oculomotor. The 4th one is the trochlear and trigeminal, and those 2 are right next to each other. So trochlear is right here, trigeminal is right here. And then the next 3 go from the inside out again, and so that goes abducens, the facial nerve, and then the vestibular trochlear nerve. It's very difficult to say, vestibular trochlear nerve. Then the 9th, 10th, and 11th, and 12th, it goes 9, 10, 11. I'm sorry, 9, 10, 12, 11, as you go down for those. So the first one we have is the glossopharyngeal nerve, which is right here. Then there is the vagus nerve, which is, you see there, it's trying to show you that there are 3 nerves right here. So the first one you're going to have is that, the vestibular trochlear nerve, but then it's going to go, what is this? This is glossopharyngeal nerve, vagus nerve, hypoglossal. So glossopharyngeal, vagus nerve, hypoglossal, and then down here is the accessory nerve. And you can see that it just goes off to everything else. And that's it.